So going third is always a bit of an interesting one in a panel, because you've either got to say something brand new or you've got to tie in with the previous panelists. And I'm pleased that actually we appear to be on similar lines. So for me, the concept of public health, I believe, is one that closely aligns with the No Natural Disasters campaign. It takes a simple notion that something that could be considered naturally occurring, such as mortality, morbidity, illness, doesn't necessarily remain acceptable because it's considered to occur naturally. So public health is focused on prevention, preventing further harm, preventing early death, and delaying death through increasing good health. And not assuming that because things occur naturally, the reality is we're all going to die. We know it occurs naturally, but it doesn't have to be inevitable as being so soon, and it doesn't have to be due to certain diseases or disasters. So it doesn't have to be a foregone conclusion that you're going to die a certain way. And I want to use the example of the ongoing COVID-19 pandemic, which has given the world an insight into risk and public health. So as of yesterday, since the start of the pandemic, we've had 6.53 million deaths globally due to COVID-19. Now, what's interesting is that when we speak to some people, they might reasonably, you might feel, argue that because of basic biology, we know viruses mutate. We know it's inevitable that there was going to be a pandemic. It was in our risk registers. It wasn't new to us in terms of a concept. And we knew from that knowledge that actually it could happen. But the subsequent disasters that occurred due to COVID, the death toll, the numbers infected, and the numbers now living with long COVID, was that natural? And was that unavoidable? Now, before I actually go to answer that question, like Terry, I want to take you back in time and a very brief history of humans. And to start with, for generations, humans sought to alter nature. We've heard this from the previous panelists. And we've looked to re-engineer the world in order to have short-term human gain. From clearing flood-prone land in order to build houses, to building sort of specific areas for foodstuffs, or repurposing land for agricultural techniques. Now, this has often been rooted in the idea that actually we should be trying to create convenience and ease for the population, and as well as making money. Let's be clear that there are other things that motivate humans. But what it has done is brought about consequences that weren't intended. So what we know is that the US CDC is saying to us that actually it's estimated that 3/4 of new or emerging diseases that infect humans have come from animals, right? It's a natural consequence of unnatural behavior with the environment. And therefore it's not a natural disaster. It is one that actually is caused by humans, because we could have prevented it through different approaches to agriculture, livestock, and environment. So going back to my original question, was the impact of COVID-19 natural? So we've concluded that viruses mutating is natural, but the impact didn't have to be natural. Now, theoretically, again, one could argue, and we heard it during the pandemic, that actually we shouldn't do anything. We should let COVID-19 run its course, right? We should actually let it, do its thing, and actually we will have, immunity. People will develop that. It's all about natural approaches. But disaster risk reduction is all about reducing the risk and putting in mitigations. It's actually about preventative public health measures. We don't let other things run their course. Obesity, diabetes, heart disease. We do what we can to prevent, and the same should have applied here as well. Now, realistically, if you have effective pandemic planning and good global public health cooperation, that should have reduced the burden of COVID-19. But the reality is, what we saw with COVID-19 is the same thing we see with other disasters, with Katrina, with other storms and hurricanes that have taken place, and with the floods in Pakistan, that actually communication, cooperation, and collaboration remains an issue. And because of that, the impact of COVID-19 was not natural. The people in power had the ability to reduce the vulnerability, exposure, and risk, but accountability at a global level is not always there, and it continues to remain a challenge. And what's interesting now is, if you think about the language, the burden of risk when it comes to COVID-19 has moved from government, has moved from societal approach, and is all about individual perception of risk and individual management of risk. And that is despite us knowing that for disaster risk reduction to work effectively, we need a collective and collaborative approach. And that's how we achieve the best outcomes for our population. So this is why when we think of public health and disasters, it's important to move away from the semantics. We're going to hear that a lot today. But it's important actually that we also move away from individuals and we begin to focus on society's role when it comes to understanding risk creation and risk mitigation. Only when we begin to take a societal approach do we begin to actually live the concept that there is no such thing as a natural disaster.